Hi everyone. So I decided to make this course on Ophthalmology Foundation exam, the optics part. I am Dr. Ambali Oye, a senior registrar, University of Lawrence Teaching Hospital. I also have previous course on optics made easy that teach people on how to draw optical diagrams and they understand those diagrams and then do some calculations because these are also very important, even not only in our local exams, even the ICU, the Ophthalmology Foundation exams or other international exams. I just decided to add an extra, like just the tips because I did my own, I've done my own Ophthalmology Foundation optics exams. And it wasn't, I mean, it's like a good if I had the experience before because it wasn't really easy. Wasn't really easy. So I felt okay. Why not just make a video and give some people tips? Again, it's tips. I mean, it can changes. So well, I'm sure you find it very, very useful. And then I based on the experience, little experience I've had twice, so can be rest assured it's going to be very, 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 very helpful. And then the foundation exam there, one cut off is quite kind of much a bit, so you need to prepare very hard. And then their main reference textbooks is the American Academy of Ophthalmology, the AO, and then the Duke Edas. Those are the main core optic textbooks. Of course, you can read Ekiti to understand some of those diagrams too, in additions. So that's why I also advise you to check my course on the optics made easy to explain to understand those calculations or diagrams because I will not be explaining that one in this course. So, to get started, I will be highlighting and I will be saying the things that I can remember, and then based on what I read, because I read the book quite a lot, so I have a much better idea on how they do this question. And the questions are not that hard, but they are deep. They require a deep understanding of the core optics. So they can bring question based on the diagrams. Okay, so based on how you understand that, you can formulate questions from there. And based on even the way the things are arranged, they can formulate questions from there. So it's quite a deep, deep understanding. And then you need to read the book, especially American Academy of Ophthalmology, back to back. And then read together. So in addition to it. So let's get started. We started with a quick start guide. Remember, a quick start guide is actually a component of it because I remember some of the questions came out from it. So which encompasses the optics fraction and then the retinoscope. So yeah, you can take note of this statement that PO camera is the simplest imaging device. And then we'll talk about the size of the pinhole later on. This is a very important aspect that can come out actually and has come out. So you have to take note of the pinhole. So it's actually the simplest imaging device and it allows for brighter images that simple pinhole does. That is the pinhole camera anyway. So both pinhole they allow for better images, but the pinhole camera has more better images than the simple pinhole. So these glossaries, I don't think okay, so what important thing, sorry about that. These, of course, these are just normal routine stuff that someone knows in ophthalmology. I mean, there's astigmatism, cynical lenses and all, which you can watch in the videos on Optics Made Easy. By the way, again, I don't want to go into the deep, I just want to give you the overall overview of how it is. So, of course, astigmatism is the one a type of refractive error that is formed by toric lenses. It's toric lenses that will form the astigmatisms. And it's also of note that the cynical lenses only exhibits one curvature in only one directions. So the other it has is like it has a plane surface and another upper part of the cylinder. So the plane surface does not have power. I will call that as it. So it's only have one curvature in one direction. Um, this is very important. The myopia that it's a refractive error is in which the distance and the near object are imaged behind the eye. Okay, so that's the myopia. It's both near and the far that is affected. That's very important to take notes. And of course, this from diagram, we've always known that once the object is at infinity, the image will always form at the focal point. And so the image distance will be saved as the focal length of that. of the lens system. Also, there's at infinity, so the image is always going to form at the focal point, so we can take it that the focal length of the system, the image distance is the essentially the focal length of the system, which is from the lens to the focal point. Again, those diagrams, I won't want to go into the details there. So just maybe a little bit of here and there. So you may want to work the videos um on optics medicine to understand some of these diagrams. Okay, so but refractive the myopia is just for in that one is nearsightedness. So it's distance objects are focused in front of the retina. So they will not be able to see far. The one will be in front of the retina is the near visions that they will see. Again, there's a diagram to make you understand that, but that's just a catch. If myopia parallels of light are coming from infinity, which are the distance one, they will form in front of the eye. It's only the near point that they will see because the far point of myopia is at an infinite distance in front of the eye. So they are nearsighted. So the distance one they will not be able to see. You may want to take note of um that too for your exams. Okay, so talking about this camera obscura, which is actually the binaural imaging, you should just read read about it. It's a very important aspect in Ophthalmology Foundation exam. And then the especially the characteristics of the image form is very, very important. So and it's the camera obscura is actually a device that consists of a small light tight room or box that has a small hole on one side. Can you see the box? And has a small hole that serves as a pinhole um on one side. And of course the hole allow the inverted image of a bright scene or a bright object projected to the opposite wall or side of the box, where it can be conveniently viewed or studied. The idea is just to at least have an idea of the characteristics of the pinhole. So from there, they were able to discover that, of course, the projected image is inverted. Okay, so and then the depth of the projected image is going to be superb. That's one of the things of pinhole. As I has very superb depth of field. So again, the depth of field and depth of focus. Okay, because I will show you later on when we move on. So depth of field, depth of focus, very important. So depth of field is seeing multiple objects. So all of those objects of various locations and they are very sharp. That means that device has high depth of field. High depth of field like a field. So you have multiple objects there. So range of object locations that will produce a very clear images on the eye by that device. That means that device has a high depth of field. So pin O has a superb depth of field. As I've said, that objects are simultaneously in focus at all distance. You get objects at different distance, they are simultaneously in focus. And the depth of field is a small aperture which allow single rays, like just small rays of light to reach a very small region in the image plane. And the image is very dim. Again, I said that projected image is inverted for this camera obscura. The depth of field is superb and the image is very dim because it's very dim because the light that will enter is very small. It's a small hole, so the light that will enter is very small. That's why the image is dim. This is very, very important. You have to take note of that for the camera obscure so they can relate it to the pinhole too. So this was the depth of it we're talking about. Can you see the difference, the oceans, the mountains and how they're all being clearly seen. So that's about that. So now if it assume you want a brighter image and then you enlarge the pinhole to admit more light. Once you enlarge the pinhole, that means multiple rays will be emanating from the object, and then it will result into this large blood cycle. So once you expect aberrations, this is very important. Once you enlarge the pupil is not as thousand as pain or like you use something bigger. um that serve as pinhole like in our eye. So when you now dilate the eye or the eyes pupil is more dilated, the pinhole effect kind of is actually reduced. So there's kind of increase in blood cycles. Because all the spectral aberrations that occur with pupil dilated is increment in the blood cycle. That blood cycle is what is causing the blood vision. Okay, so once you enlarge this pinhole size, the aperture, to result into blood um cycle, and then it will reduce the clarity of the image. So and so if you now have that, you want to get a brighter image, and then you now like the pinhole ball is now having a large blood cycle, you could actually focus those rays coming from the object by putting a larger aperture of lenses, so further converges further. So again, this paragraph share is very important to read back and forth and get that very well. Can you see this picture rotation is very important for you to understand it more too. This was the size of the pinhole before, and you see there is really not any blood cycle, but immediately you widen the pupil, the pinhole, I mean, so you have a larger blood cycle. It's very important. There's a way they can frame it for you, or enlarging BP, a pinhole will cause, or when you dilate the eye, does it increase the blood cycle, things like that. You get, so it's very important to take note of that. So, um, so the next thing is convex lens. So, I mean, it's quite a lot. I am not going to the details of the convex lens. Everything is in the optics made easy to understand those diagrams and those calculations. They usually ask such calculation in Ophthalmology Foundation exam. I don't know why. The calculation they ask, they're usually the simplest one. Actually, most time they're usually simplest ones, the simplest you can get. So, of can take note of the power too. How to calculate the power of the lens, Let me just state that a bit. I mean, just to show you, it's not common. I mean, I've not, but I think it's something to take notes. Or is equal to 1 over current. Again, as a calculation in Optics make this easy to tell. You can check out you for more additions. So in meters. So that's it. That's the formula. So let's assume they give you a focal length of let's say 0.50, maybe 50 cm or something, which will now convert to meters 50 on length. It's called 0.5 meters. So our power now equals to 1 over 0.5. That will be equal to 2. The advantage of IFF is that I think the one that those that have done though, they actually require you to use calculator. And they give you you are allowed to bring calculator inside, so you may not want to know the shortcuts for that. But if you want to know shortcuts how to calculate some of these things, you can check my videos on Optics Made Easy to understand better. This is not really important. The exam so far, there has not been anything that wanted to combine lenses. This is what we were saying earlier. That if you have parallels that are coming from infinity, for lenses, even for mirrors too, they will converge. This is a convex lens. You can see it's by convex, so it's going to converge at the focal point. And so this is the focal length that we're talking about. So let me just, I said I was going to draw a sketch, but let me just draw that sketch to make you understand a bit. Um, so, all right. So we have for lenses, those are parallel of light that come from infinity. So they're going to be found at the focal point there. You have like F2, again, there are videos on this that I've made So once you have, because F2 is like the point of, convergence of parallel rays that come from infinity if it's convex lens. Or it's concave lens is the point in which parallels of light diverge from. So this is a convex lens, obviously. Lens and distance object at infinity. So this was the focal length we were talking about. So it will serve as the focal length for that, and that's what determines the power. It's the F2, second focal point that determines the power of the lens. So this will be the focal length of that lens. What we're seeing here. So that's the diagrammatic explanation for that. So yeah, then that's the combination of lenses. Is not that important. So the surgery distance, image distance, because calculations on lens maker equation are not maybe a little bit here and there. So you should take note of the formula that is U plus U plus P. Some use D, some use whatever equals to V. We use plus D equals to V, or what did they use P down here, so use plus P. So you can use D, some use F self, so plus P equals to V. That's if the formula for the to calculating the distance, and also which is similar to um okay, so it is equal to, instead of one over U, the U is the object variance, so the P is power, and that's why it's shaped like this. So let me just write in this, and then it is. So again, the U is equal to the object divergence. Just to take notes, it's not a common thing actually. P equals to the power of the lens, or even same also V is equals to image divergence. So that's the so again, let me just write it here again. V is equals to the image divergence. So I should know that if the object is located to the left of the lens, usually most of the time use negative. If object is to the left of the lens, which is usually the case anyway. It's of the lens or mirror can be mirror too. That's when you do negative. And then the P power can vary. Power of convex lens is equal to positive. Power of concave lens is equal to negative. So can you see the left of the lens still has negative? And now, so I'm sure you know this ones. Um, so that's the equation called convergence equations. These are not commonly asked. I mean, their calculations are not even that deep. So again, the power of a negative lens is power of a concave lens is negative. So a negative lens will diverge image. A positive lens will converge image. Um, so this is not really. So this is the negative lens we're talking about. Image function by negative lens is only two. If you're just looking at infinity, and then if you look at is located at any distance from the lens, you can check my videos again. to understand that, but negative lens will diverge. You can see rays are coming from infinity, parallel rays are coming from infinity, because the negative lens is going to diverge. And so it's a format F. This is also the focal length for that concave lens, and it's a virtual. Unlike the other one, the convex lens will form a real image because they are converging. A real image are formed when rays are converging. But when the rays diverge, and you have to extrapolate it, the image that will form is a virtual image. Let me just show that a bit. Um, Again, if you want to still learn more, please check on diagrams. There are videos, quite a lot of videos on diagrams that you can check up. So you have it that coming from infinity. They're going to diverge since the concave lens. So when they diverge, it's just extrapolated rays. They're not from a virtual image at focal point. So that's what focal point two. That's focal point. So at that distance again, just like we did for the convex, is the the focal length of that of the lens, which concave lens is amount. So because the power of concave lens is negative. So can actually do combination of power. It's not a common thing. So that's the summary. You want to read the summary to get that. So we'll start from here in the next reading.